Welcome to UTMB's Texas Transplant Center. Our transplant program hospital is located in Galveston, Texas. However, for your convenience, we have clinics in Beaumont, Victoria, League City, and McAllen, Texas. Our Medicare-approved kidney transplantation program was established in 1967 and was the first in the Houston and Galveston area. Our goal at the Texas Transplant Center is to provide exemplary care by applying our talents, skills, and the latest medical knowledge. We strive to achieve excellent results and exceed national standards for patient and graft survival. UTMB Texas Transplant Center also offers living donor kidney transplant, participates in paired donation programs, and offers programs for incompatible live donors. Please watch the pre-transplant education video. If you have any questions, please call us at 800-323-4109. Thank you. At the end of this video, we hope that you and your family members will understand the evaluation process, know the benefits and risks, and be able to discuss the transplant process to determine if it is the right choice for you. Here are some quick facts about the kidneys. They are bean-shaped organs that make up part of the renal system. They perform many functions. They filter waste from the blood, produce renin, which regulates your blood pressure, and erythropoietin, which stimulates red blood cell production in your blood. They maintain water and mineral balance, and produce vitamin D, which is essential for bone health. When the kidneys do not function properly for 3 months or more, this is considered chronic kidney disease or failure. Some common causes of chronic kidney disease can be diabetes, high blood pressure, immune diseases, chronic viral illnesses such as HIV and hepatitis, and polycystic kidney disease. You will be required to go through an evaluation process and testing to determine if transplantation is the best choice for you. The evaluation will include blood tests, imaging scans, screening for serious conditions such as cancer or cardiac disease, a psychosocial evaluation, dietary consult, and a meeting with the Transplant Selection Committee. This entire process must be completed before we can place your name on the wait list and before transplantation can occur. The evaluation process is beneficial because it will give you a better understanding of your overall health and the chance to be placed on the UNOS waitlist, which can hopefully lead to you receiving an organ to improve your overall health. There are some risks, however. These include possible identification of a new disease process, discomfort from the tests, bruising from IVs or blood draws, allergic reaction to IV dyes, and exposure to small amounts of radiation. Now we will cover how to qualify for a transplant. You may qualify for a kidney transplant if you have chronic kidney disease, a creatinine clearance of less than 20, dependent on dialysis, and if you may also need a pancreas, liver, or heart. A vital part of the assessment process for a kidney transplant is the evaluation to identify contraindications. There are a handful of patients who will be assessed on a case-by-case basis. There are a handful of absolute contraindications to receiving a kidney transplant that we will now discuss. A kidney transplant is strongly not recommended if you are over 75, have a BMI greater than 40, have active or unresolved cancer, severe atherosclerotic or coronary artery disease, currently abuse drugs or alcohol, or have a positive toxicity screen over a 6-month period, severe or untreatable congestive heart failure, sepsis, severe psychosocial problems that would interfere with post-transplant care adherence, severe deconditioned state, have HIV, HIV with B-cell lymphoma, active tuberculosis, or if you are pregnant. It is very important to look at the whole picture throughout the process of kidney transplantation. Now we will discuss A to B blood type transplantation. Unfortunately, blood type B candidates have to wait longer to get a kidney. In December of 2014, the new kidney allocation system became effective, including Policy 85D, allocation of kidneys by blood type. This allows for all blood types A, non-A1, and AB, non-A1B donor kidneys to be transplanted to blood type B recipients who meet certain criteria. Blood type B with a positive anti-A titer greater than 1 to 8 will not be considered for an A2 or A2B donor. There is an informed consent that needs to be signed for those who are blood type A receiving a kidney from a person with blood type B and vice versa. The indications for both a kidney and pancreas transplant are similar to those with a kidney transplant and include dialysis dependence, creatinine clearance of less than 20, diabetes mellitus with hypoglycemic unawareness, evidence of end organ involvement from diabetes mellitus, if you are on insulin with a C-peptide less than or equal to 2, or on insulin with C-peptide greater than 2 and have a BMI less than or equal to 28. The following are a few relative contraindications for a kidney and pancreas transplant. If you are older than 55 with previous cigarette smoking and documented vascular disease, COPD, pulmonary hypertension, chronic active hepatitis B, lack of adequate financial or social support, current non-adherence with medical regime or dialysis treatments, myocardial infarction within the previous 6 months, or any open wounds. Your case will be reviewed independently. The following are absolute contraindications for a kidney and pancreas transplant. If you currently use drugs or alcohol or have a positive toxicity screen over a 6-month period, active malignancy or malignancy in remission less than the time period suggested, you are an active smoker, have class 1 obesity with a BMI of 30 to 34.9 or higher, are underweight with a BMI less than 17, have severe or untreatable and inoperable atherosclerotic or coronary artery disease, class 4 untreatable congestive heart failure, sepsis, if you are HIV positive, if you have AIDS, psychosocial or behavioral abnormalities which would interfere with compliance post-transplant, a severe deconditioned state, a current positive pregnancy test, or a colostomy. You may be wondering who will be reviewing your case. This group is called the Multidisciplinary Transplant Committee. This committee reviews all available medical information and test results, determines whether you are approved for listing, or if further evaluation is needed. The team also decides if you qualify or not for placement with UNOS. The team must make that decision as a whole. The team consists of the transplant nephrologist, transplant surgeons, nurse coordinators, social workers, dietitians, transplant pharmacists, and assistant coordinators. However, the focus is on you. Once you are approved for the transplantation, your name will be placed on the national wait list. If you have a potential living donor, you will receive a phone call and a decision letter. If you are suitable for transplantation, evaluation of the donor can be started. So what is the waitlist? The waitlist is a national database where potential recipients' information is entered to be virtually matched with the deceased donor. UNOS, or the United Network for Organ Sharing, is a private nonprofit organization that manages the nation's organ procurement and transplant network, or OPTN, under contract with the federal government's Department of Health and Human Services. The federal government manages the national waitlist, matching donors 24 hours a day, 365 days a year, and monitors every organ match to ensure equitable allocation of organs and that allocation policies are followed. While on the waitlist, it is important to keep the following things in mind. Your wait time starts the day you begin dialysis. You will need to be reevaluated every year. This means you may have to be seen in a clinic or have testing done. It is very important to maintain your overall health. You can do this by keeping all medical and dialysis appointments, taking all your prescribed medications, maintaining a healthy lifestyle by following diet and exercise programs recommended by your doctor, and complying with all recommendations regarding alcohol and drug use. If you do not have a primary care physician, you should get one now. If you need help finding or choosing a primary care physician, please talk with our social worker or transplant coordinator. While you are on the wait list, you should be prepared to have a hospital bag ready. Make a list of all your medications and keep it with you, and keep a list or pack all the things you need to bring to the hospital. This includes medications, comfortable clothes, toiletries, insurance cards, CAPD supplies, plus a transfer set if you are on peritoneal dialysis, and CPAP supplies. Our goal is to keep you in the best physical condition possible so you will do well with the transplant. One thing that you must know is that you can be listed on multiple wait lists of transplant centers throughout the country. All patients are encouraged to be listed in multiple transplant centers. However, you must apply, be evaluated, and accepted as a transplant candidate at each center. You are required to sign a form at the end of this video confirming that you are aware that you can be listed on multiple waiting lists. Now let's discuss the different types of kidney donors and donor-related risks and benefits. Kidney donors specifically can be living or deceased. There are different types of living kidney donors. A living related donor is a donor who is related to you, such as a parent, sibling, or child. A living unrelated donor is unrelated to you. This could be a friend, coworker, or member of your congregation, for example. An altruistic or anonymous donor is someone you do not know or who prefers to be anonymous. Paired donations, also known as a kidney swap, occurs when your living donor is incompatible with you. Your donor would give a kidney to another donor-recipient pair who does match, and the other donor gives a kidney to you. In the end, 2 people will receive a donation. First, we will discuss the living donor. There are many benefits to receiving a kidney from a living donor. Living donor transplant kidneys have the best outcomes of all transplants. Living donor transplants usually require less anti-rejection medication. Sometimes there is no wait or possibly less waiting time on the list. This can mean getting a transplant before you start dialysis, known as a preemptive transplant, or a shorter time on dialysis. Wait time on the UNOS list can be an average of 1 to 5 years, but can be up to 10 years or longer, depending on your case. The success and survival rates are higher, it is a better quality kidney, a better genetic compatibility, which lessens the risk of rejection, and an increased chance for immediate and better long-term kidney function. There will be a shorter cold ischemic time, which is the amount of time the organ is out of the body without blood supply. With a living donor, it is 30 to 90 minutes, but up to 24 to 48 hours with a deceased donor. With the living donor transplant, the surgery can be planned and scheduled when convenient for both donor and recipient, and when they are in the best health for surgery. To qualify, a living donor must be healthy, have no chronic disease or active malignancy, and be freely willing to donate. Potential living donors must have the same blood type as the recipient. A potential living donor cannot have a history of cardiovascular disease, cancer, pulmonary disease, HIV, untreated hepatitis, insulin-dependent diabetes, diagnosed psychiatric conditions with suicidal thoughts, active alcohol or substance abuse, or evidence of suspected coercion or donation for valuable consideration. The procedure for the living donor is called a laparoscopic nephrectomy. This is a minimally invasive surgical procedure with only a few small incisions that leave minimal scarring. The donor stays at the hospital for 1 to 2 days and can return to normal activities in 2 weeks. A donor's long-term survival rate, quality of life, general health status, and risk of kidney failure are about the same as the general population. It is recommended that the donor have regular checkups after donation to monitor kidney function and their general state of health. So how can you receive a living donor transplant? Talk to your friends, family, and religious groups about your disease as soon as you are diagnosed with end-stage renal disease or kidney failure, even before starting dialysis. Ask any potential donors to call 409-772-1451 and press option 1 to get the process going and to ask questions they may have. Please note that the full evaluation of the donor will only start after the recipient has completed his or her pre-transplant evaluation and has been cleared and accepted for transplant. For more information about living kidney donation, please visit the following sites. Now let's talk about the types of deceased kidney donors. Brain-dead donors are known as standard care donors, or SCDs, and may be kept on a breathing machine to keep the heart beating and provide blood flow to the body. A cardiac death donor, also called a DCD, or donation after cardiac death, happens when the heart has stopped beating, blood flow has stopped, and the donor has not been placed on a breathing machine. As long as it is for a short period of time, the kidneys and pancreas may be used from a donor whose heart has stopped beating, even though no blood flow is circulating through the organs. A public health service donor is a donor that has identified behaviors which increase the recipient's risk of viral infections like HIV, AIDS, HBV, and HCV. 20% of the local donor pool is made up of public health service donors. Public health service donors, on average, are younger than the standard donors, and their kidneys tend to be high quality with a low risk of losing the organ. You may be able to get a transplant sooner if you choose to wait on the Public Health Service donor list instead of just the SCD list. It's important to consider that staying on dialysis for many years could be riskier than accepting an organ from a public health service donor. So, what are the risks associated with a public health service donor transplant? There is a risk of infection. The possibility that a public health service donor is infected and would transmit the infection is 46 out of 100,000. New sensitive testing can detect exposure to viruses much earlier. Non-public health service donor transmission risk is 2.4 out of 100,000. Hemodialysis also involves a risk of transmission for hepatitis C. Now you may be wondering how we will determine if your donor is a match. We do this through compatibility testing. At UTMB, we test the blood type to see if they are compatible with the recipient. We will also do tissue typing and antigen testing, which determines the type of antigens in the person's cells or tissues. This can help find the best match for a kidney transplant. Cross-matching is the final test done to determine if the recipient is compatible with the donor. A positive cross-match means that the recipient will reject the kidney and the organ cannot be transplanted. Ideally, we want a negative cross-match. Now that you have learned about the types of donors, let's talk about how we score the function of the donor kidney. You will receive this information if we call to tell you there is an organ available. Every kidney offered for transplant has been given a score 0 to 100 called the Kidney Donor Profile Index, or KDPI. This score is associated with how long the kidney is likely to function when compared to other kidneys. The higher the score, the shorter time the kidney is predicted to last. You must sign a consent form if you want to be offered a kidney with a KDPI score of greater than 85%. Benefits of receiving a kidney with a score of 85% or greater means possibly spending less time on the wait list. As with all transplants, there are risks involved. There is an increased likelihood of poor kidney function after transplant, which may mean more dialysis after the transplant and a longer hospital stay. There is also a greater chance of the kidney not surviving as long. Luckily, you have many options. If you do not want a kidney with a KDPI score above 85%, your place on the waitlist will not be affected. You will still be eligible for a kidney with a KDPI below 85%. Your consent means that you will be listed for all KDPI kidneys. If you agree to accept an organ with a KDPI score above 85%, you are still eligible to receive a kidney with a KDPI score below 85%. We understand that it is very difficult to be on the waiting list for an organ. However, we must emphasize that in the U.S., it is illegal for donors to be paid or compensated in any way for donating organs. Anyone who violates this law may be fined up to $50,000 and/or up to 5 years in prison. It is okay to provide travel assistance or small gifts to your donor, but their income or bank account should not undergo a sizable change, which would indicate they received a payment for donating an organ. What do you do when you get a call about a kidney? Most importantly, answer the phone. The call may come at any time, day or night, so always be ready. Here are a few steps to ensure you will receive notice of an available organ. We need to have multiple current and correct contact numbers from you. It is important to keep your voicemail empty. Make sure to review your contact information at each doctor's visit. You must call us immediately if any of your information changes. A call from UTMB may show up as an unknown or blocked number, so answer any phone calls you receive, even if you don't recognize the number. We have 1 hour to contact you until we move on to the next person on the wait list. Once you receive the call, the transplant coordinator on call will discuss the kidney offer with you. If the kidney is coming from a donor with a KDPI above 85%, your transplant surgeon or designee will help you make an informed decision. Then you will be asked questions to assess your current state of health. You must answer them honestly. If you accept the offer, you will be given instructions on what to do and how to proceed with admission to the hospital. Remember, you have the right to refuse the kidney offer, and your place on the wait list will not change. If you accept the offer, you will go into the next steps of tests to ensure you are healthy enough currently for the transplant. Occasionally, however, a patient goes back home without getting the transplant because they are not in good health. If you accept the offer, you will have these tests, which are similar to the ones you had to get to be on the wait list. A thorough history and physical examination, a possible chest X-ray and EKG, blood work like a CBC, a CMB, a type and cross, and serology. You may have a peripheral IV line inserted. You will have a nephrology and a cardiology consult if necessary. You could receive IV fluids or medication, for example, for sedation during the procedure, or the doctor may order other tests not mentioned here. After you've been cleared, surgery can begin. Here are a few things you should know about your surgery. This procedure requires general anesthesia. A urinary catheter will be placed in the bladder at the beginning of the surgery in order to monitor urine output. It will be removed a few days after surgery. It is possible that you will have an IV catheter placed into a vein in your neck to help monitor blood pressure, give medications, and draw blood. An incision will be made on the side of your body where the organ will be placed. The skin and muscles are opened and a pocket is created in the abdominal cavity. The main blood vessels, iliac artery and vein, are located at the base of the pocket. The surgeon will sew the kidney's artery and vein to these vessels to establish blood flow to the kidney. The non-functioning kidney will be left inside your body unless the surgeon thinks it needs to be removed. The tube that drains urine from the kidney will be attached to the bladder. The surgeon may need to place a stent in the ureter to keep it open. There will be a small Jackson-Pratt drain, also called a JP drain, placed on the side where the incision was made to help drain extra fluid from the area. This will be in place after surgery and most likely will be removed before discharge. Your surgeons and physicians cannot predict how your body will respond to your transplanted organ and the medications needed to maintain it. You must be aware of the potential risks and complications that could result in serious injury and even death. The transplant operation is a complex procedure and the risks are high for many patients. There may be a need for repeated biopsies, surgeries, and other procedures. You may experience bleeding, rare infections, and blood clots in the legs. Potential sexual dysfunction is also a risk. You may need to stay in the hospital longer if these risks occur. There is always risk of rejection, which means your body considers the transplanted organ to be foreign and attempts to destroy it. To reduce this risk, you will be prescribed medications known as immunosuppressants. Side effects may include a decrease in your body's ability to fight infections and make other conditions worse. The conditions that can be made worse from immunosuppressants are diabetes, bleeding from the GI tract, increased blood pressure, increased cholesterol levels, and cataracts. You must take the full dose prescribed exactly the way your doctor has ordered. You will take these medications for the rest of your life to ensure your body does not reject your new organ. Immunosuppressants also increase the risk of developing cancer. Please remember that you should be screened annually for cancer after your transplant. UTMB is required to provide the public with specific statistics on survival and failure rates of kidney transplantation every 6 months. This is called the Scientific Registry of Transplant Recipients Report. To learn more, visit www.srtr.org. Here are some crucial facts to know about the transplant surgery. Loss of kidney function may not be avoided, and recurrence of the original disease is possible. You may notice increased anxiety, depression, and feelings of guilt. The transplant team and social worker will work to provide support for you and your family throughout this process. You will be discharged from the hospital after 3 to 5 days. There will be pain and discomfort, but you will have an IV line for fluids and medications. You may need dialysis to help remove excess fluid and clear toxic waste until the transplanted kidney starts working. You are most likely used to drinking minimal amounts of water before the transplant, but the new kidney needs to be well hydrated, so it is important to increase your intake of water. It is important to perform deep breathing and coughing exercises to prevent pneumonia. The goal is to get out of bed and walk with assistance within 24 hours or less. You will be required to stay in the Galveston area for 2 weeks after surgery. You will not be able to drive for 4 to 6 weeks after surgery. It is important to avoid tub baths and swimming until the incision site is completely healed. This may take up to 8 weeks. To prevent an incisional hernia, avoid strenuous exercise and heavy lifting for 3 to 4 months after surgery. Avoid contact sports to prevent damage to your transplanted kidney. It is important to know that you and your family are responsible for the cost of medications, picking up the medications ordered from your local pharmacy, and for transportation and housing. You will need to visit the transplant clinic every Monday and Thursday for 4 weeks to get blood work done. After that, you will visit once a week, then once a month, and then yearly. You may go home and be seen in one of UTMB's local transplant clinics in Beaumont, Victoria, or McAllen. Overall, it is extremely important that you take care of yourself. You are in charge of your health, especially when it comes to taking care of your new and healthy kidney. This includes making sure you have a primary care doctor, knowing what medications you are taking, what it is for, the doses, the side effects, and what to report to your provider, being aware of the signs and symptoms of infection, flu-like symptoms such as fever, chills, headache, pain, fatigue, and rejection of your transplanted kidney, and calling the post-transplant coordinator if you have any questions. Any surgeries, hospitalizations, and changes in your medical status must be reported to your transplant coordinator. If you require hospitalization, we would prefer it to be at UTMB so we can monitor your condition carefully. However, if you are hospitalized at another institution, you must make sure that the doctor in charge of your care contacts us to provide information about your medical status, whether you are being transferred to UTMB or not. This is very important to ensure the best possible care for your specific transplant case. Let's talk a little bit more about insurance and current benefits. We will request approval from your health insurance company to place you on the UNOS waitlist. Our financial coordinators will check your health insurance information and provide the company with updates regarding your medical condition. Therefore, it is very important that you call us with any changes in your health insurance before they occur. After a transplant, your insurance company may consider you as having a pre-existing condition, which could lead to a denial of claims, treatment, or procedures. In addition, your health insurance, disability, and life insurance premiums may increase and remain higher, or you may be denied coverage. Currently, UTMB Texas Transplant Center has Medicare approval for the kidney, pancreas, liver, and heart transplant programs. However, if you have your transplant at a facility that is not approved by Medicare, your ability to have your immunosuppressive drugs paid for under Medicare Part B could be affected. If you are currently receiving American Kidney grants to help raise money for transplant, this will stop after your transplant. You can get additional information from the United Network for Organ Sharing at www.unos.org or by calling the toll-free patient service line at 1-888-894-6361. Every transplant center is required to provide the following information which has been covered in this video. This includes an overview of the transplant process, surgical procedure and risks, the importance of following the prescribed medical regimen, financial implications of the transplant, and patient survival outcomes at UTMB as compared to expected and national outcomes. We will ask you to sign the evaluation consent document at the end of this video. By signing, you acknowledge that you have received and read a copy of the Kidney and Pancreas Transplant Candidate Education Packet and were provided the opportunity to ask questions. You will also consent to undergo the UTMB transplant evaluation process for living donation and inclusion on the UNOS waitlist. Thank you for watching. We look forward to working with you.